Alright, so this is going to be a review for Chapter 14, an exam review. Be sure you have a pen and paper handy to write down, take notes, and write down the questions that I'll be asking. Or you can alternatively open up a Word document or Pages and document and just start typing this as well. Please don't email me, ask me for the questions. I will not be sending out this document. The reason being, as I mentioned in previous reviews, I expect you guys to open up your books and look up these answers using your textbooks. Just giving the answers away, it's not going to help you on your exams. Because remember, the questions that I'm asking you, uh, they're not necessarily the same questions you'll see on the exams. There may be similar questions. So in finding answers for the questions that I'm looking for, you'll likely learn other material that will be on the exam. So let's get going with this. So make sure you know this image over here. What we're looking at over here, so again, these are nerve cells. So what are we seeing? This is a multipolar neuron that we see over here for a somatic nervous system. And then these are the multipolar neurons that we have in the autonomic nervous system. And again, as you know, the autonomic nervous system has a sympathetic and a parasympathetic division. So when you look at this axon over here for the somatic nervous system, notice that the axon is heavily myelinated, and the neurotransmitter that's at the effector is acetylcholine or acetylcholine, and it has a stimulatory effect. So what's the effector organ? Skeletal muscle. Now in the ANS, for both the parasympathetic and the sympathetic divisions, the preganglionic axons are lightly myelinated, as you can see, and both the postganglionic axons are non-myelinated. For the neurotransmitter at the effector, we have norepinephrine for the sympathetic division and acetylcholine for the parasympathetic division. And the effects will be either stimulatory or inhibitory, depending on the neurotransmitter and the receptors on the effector organs. And so keep in mind when you on an exam, this is not going to be labeled, so be sure you know what's what when you're looking at this. So when you're studying, print this out or look at your book and just kind of cover it, put your hand on it and make sure you're able to identify. So if this were whited out, make sure you know that it's referring to lightly myelinated preganglionic axons. And where is this going to be found? Again, these are found in the sympathetic division. And how do we know that this is sympathetic division? Well, one of the things is, again, if they had this image over here and they're telling you that the neurotransmitter is the norepinephrine, notice that for parasympathetic, it's going to be acetylcholine, right? So that's one of the ways that you should be able to realize the difference between the two. So let's look at some of the questions that you could expect. So which one of the above is heavily myelinated? Which one is non-myelinated? Okay, which axon is non-myelinated? Which innervates skeletal muscle? Okay, another question could be, which one of these innervates cardiac muscle? Okay. Identify the postganglionic cell body. Okay, identify the postganglionic cell body. Do visceral reflex arcs lack afferent fibers? Do visceral reflex arcs lack afferent fibers? Do adrenal medulla secretions supplement the effect of sympathetic or parasympathetic stimulation? Do adrenal medulla secretions supplement the effect of sympathetic or parasympathetic stimulation? Number 7 is, would sympathetic stimulation constrict or dilate the pupils? Number 8, does the ANS innervate skeletal muscles? Number 9, which ANS division is responsible for fight or flight? Which ANS division is responsible for fight or flight? Number 10, which ANS division is responsible for rest and digest? What would we find cholinergic nicotinic receptors at all parasympathetic organs? Number 12, what organ does the ciliary ganglion serve? What organ does the ciliary ganglion serve? Number 13, would we expect the sympathetic division to constrict or dilate blood vessels in the intestines? Number 14, which cranial nerve are most parasympathetic fibers derived from? Which cranial nerve are most parasympathetic fibers derived from? Number 15. Are both the somatic and autonomic nervous system have their activities regulated by higher brain centers? Okay. Number 15. Are both the somatic and the autonomic nervous system have their activities regulated by higher brain centers? Number 16. Which part of the brain is responsible for your thirst and temperature controls? Okay. Number 17. Is sympathetic origin thoracolumbar and parasympathetic craniosacral? Number 18. Why are sympathetic responses generally widespread? Which neurotransmitters are usually involved? Number 19. Which vertebra do sympathetic nerves leave the spinal cord? Which vertebra do sympathetic nerves leave the spinal cord? Do autonomic ganglia contain cell bodies of motor neurons or sensory neurons? Number 21. Parasympathetic fibers of which cranial nerve allow for the lens of the eyes to accommodate close vision? Number 22. What are the structures formed when fibers enter and exit the sympathetic trunk without synapsing called? Okay. What are the structures formed when fibers enter and exit the sympathetic trunk without synapsing called? Number 23. Name the plexuses of cranial nerve 10. Name the plexuses of cranial nerve 10. So again, for this question, you should be able to know the name of cranial nerve 10, right? Also, so again, this might have the name instead of cranial nerve number 10. It might say vagus nerve. So name the plexus of the vagus nerve. Number 24. How do visceral and somatic reflex arcs differ? Number 25. Would parasympathetic tone determine the normal activity of the urinary tract? Would parasympathetic tone determine the normal activity of the urinary tract? Okay, number 26. When a sympathetic preganglionic axon reaches the trunk ganglion, will it synapse with the parasympathetic neuron in the same trunk ganglion or synapse with the ganglionic neuron in the same trunk ganglion? Okay, one more time. When a sympathetic preganglionic axon reach a trunk ganglion, will it synapse with the parasympathetic neuron in the same trunk ganglion or synapse with the ganglionic neuron in the same trunk ganglion? Number 27. Does reticular formation or the midbrain exert the most direct influence over the autonomic function? Does reticular formation or the midbrain exert the most direct influence over autonomic function? Number 28. What effects do beta blockers have on the heart? Okay. What effects do beta blockers have on the heart? Number 29. Would penile or clitoral erection under sympathetic or parasympathetic control? Okay. Would penile and clitoral erection be under sympathetic or parasympathetic control? Number 30. Is body temperature a sympathetic or parasympathetic function? Number 31. List 5 sympathetic functions. And for number 32, list 5 parasympathetic functions. So again, make sure you know what the sympathetic and parasympathetic nervous system is about. So again, if you guys are a little bit confused, I made a video a while back. I'll put a link for it over here, but it kind of goes over the divisions of the nervous systems, and it kind of gives you an overview of a bit of an overview over what we're going over here. So you may want to look at that. I'll put a link for it over here, somewhere around over here. So be sure to look at that if you want. But remember, one of the ways that you can remember sympathetic from parasympathetic, again, sympathetic starts with the letter S, parasympathetic starts with the letter P, and stress also starts with the letter S, and peace also starts with the letter P. So for sympathetic functions, think about what happens to your body under stress. Okay, and for parasympathetic functions, think about what happens to your body when you're at peace. Okay, so again, I'm not going to give the answers for you guys to look up, but I just wanted to throw this out at you. Again, this is a good way to remember sympathetic and parasympathetic. Think of stress and peace. What are the signs and symptoms of Raynaud's disease? Okay, signs and symptoms. Number 34, what is autonomic dysreflexia? What is autonomic dysreflexia? Number 35, which sympathetic fibers form a splanchnic nerve? Okay, which sympathetic fibers form a splanchnic nerve? Number 36, does beta 1 or alpha 1 receptors play a major role in heart activity? Okay, does beta 1 or alpha 1 receptors play a major role in heart activity? Number 37, would you find autonomic ganglia within the spinal cord? Number 38, would sympathetic division stimulation cause an increase in GI activity? Okay, number 38, would sympathetic division stimulation cause an increase in GI activity? Number 39, which cranial nerve affects GI motility? Number 40, which cranial nerve is a major route from the head for parasympathetic outflow? Which cranial nerve is a major route from the head for parasympathetic outflow? Number 41. Do emotions influence autonomic reactions through integration in the hypothalamus or thalamus? Number 42. Does muscarine bind to postganglionic cholinergic fibers or cells of the adrenal medulla? Okay. Would sympathetic stimulation increase glucose uptake in the liver from whole blood? Number 44. Does sympathetic or parasympathetic stimulation promote urination? Number 45. Which type of drug is used to dilate the pupils for retinal examinations? Okay. What drugs do they use to dilate the pupils for retinal examinations? Number 46. Do sweat glands or the small intestines receive dual innervations? Okay. Does the sweat glands or does the small intestines receive dual innervations? Number 47. Which neurotransmitter is released by parasympathetic postganglionic fibers? Okay. Which neurotransmitter is released by parasympathetic postganglionic fibers? Number 48. Are the rami communicantes associated only with the parasympathetic division? Number 49. Do the gray rami communicantes consist of myelinated postganglionic fibers? Okay. Do the gray rami communicantes consist of myelinated postganglionic fibers? Number 50. Which ANS division innervates more organs? Okay. Which ANS division innervates more organs? Number 51. Can the ANS cause both activation and inhibition of the same effector? Number 52. Which division is the celiac ganglion primarily associated with? Number 53. Do all visceral organs receive dual innervations from both divisions of the ANS? Okay. Do all visceral organs receive dual innervations from both divisions of the ANS? Number 54. Are thermoregulatory responses controlled by the sympathetic division? Number 55. Do most ANS disorders involve abnormalities of smooth muscle control? Number 56. Why is the adrenal medulla considered to be a misplaced sympathetic ganglion? Why is the adrenal medulla considered to be a misplaced sympathetic ganglion? Number 57. Is acetylcholine released by all somatic motor neurons and by postganglionic parasympathetic nerve fibers? Number 58. Do sympathetic and parasympathetic divisions have the same effects on organs? Do sympathetic and parasympathetic divisions have the same effects on organs? Number 59. Do sympathetic preganglionic fibers have the ability to cause the adrenal medulla to produce a surge of adrenaline? Number 60. Do cranial nerves 8, 9, and 10 contain postganglionic fibers of the parasympathetic nervous system? Okay, do cranial nerves 7, 9, and 10 contain postganglionic fibers of the parasympathetic nervous system? Number 61. Does the autonomic nervous system stimulate skeletal muscle? Okay, does the ANS stimulate skeletal muscle? Number 62. Which organ or organs does the somatic nervous system innervate? Number 63. Do cholinergic fibers release norepinephrine? Number 64. Are autonomic ganglia motors ganglia? Are autonomic ganglia motor ganglia? Okay, number 64. Are autonomic ganglia motor ganglia? Number 65. What is another name for the craniosacral division? Okay, what is another name for the craniosacral division? Could actually be two answers for this. Does information get transmitted at the synapse of autonomic ganglia from preganglionic to postganglionic neurons? Does information get transmitted at the synapse of autonomic ganglia from preganglionic to postganglionic neurons? Number 67. Are the majority of blood vessels innervated by only the sympathetic division? Number 68. Do both divisions innervate at the skin? Okay. Do both divisions innervate at the skin? And again, we're talking about sympathetic and parasympathetic. Do both divisions innervate the heart? Number 70. Is ejaculation caused by sympathetic or parasympathetic stimulation? Number 71. Are splanchnic nerves sympathetic? Are splanchnic nerves sympathetic? Number 72. Do most splanchnic nerves pass through the abdominal aortic plexus? Do most splanchnic nerves pass through the abdominal aortic plexus? Number 73. Is vasomotor tone of blood vessels under sympathetic or parasympathetic control? Number 74. What other receptors aside from beta adrenergic receptors are found in the heart? Number 74. What other receptors aside from beta adrenergic receptors are found in the heart? Number 75. Do visceral reflexes cause both bladder and rectum to empty? Do visceral reflexes cause both the bladder and the rectum to empty? Number 76. Are preganglionic fibers found in cranial nerves 3, 7, and 9? Are preganglionic fibers found in cranial nerves 3, 7, and 9? Number 77. What does the sacral part of the parasympathetic division serve? What does the sacral part of the parasympathetic division serve? Number 78. Does white or gray indicate myelination of or the lack of it respectively in fibers passing through the rami communicantes? Okay. Does white or gray indicate myelination of or the lack of it respectively in fibers passing through the rami communicantes? Number 79. Does the autonomic and somatic nervous system lack any functional overlap? Number 80. Which receptor does albuterol bind to in order to dilate the lungs? Okay, which receptors does albuterol bind to in order to dilate the lungs? Number 81. Are long postganglionic fibers sympathetic or parasympathetic? How about short preganglionic fibers? Number 82. Is collateral ganglia sympathetic? Number 83. Would the parasympathetic activate after a steak and shake meal? Okay. Would the parasympathetic division be activated after a steak and shake meal? Number 84. Would an increase in heart rate be sympathetic or parasympathetic? So again, over here, make sure you know the effects of, I told you before, make sure you know what the effects of the sympathetic and the parasympathetic divisions are. So again, what happens to heart? What happens to your skin? In what effects does the sympathetic system have on skin? What will it do to your pupils? What will it do to your heart rate? What will it do to glucose levels? What will it do to body temperatures? What will it do to metabolism? Make sure you know these things about both divisions. Number 85. Is sympathetic or parasympathetic responsible for the maintenance functions? Okay, is the sympathetic or the parasympathetic division responsible for maintenance functions? Number 86. Would parasympathetic increase your blood pressure? Okay, would the parasympathetic division increase your blood pressure? Number 87. Which neurotransmitter would be secreted by preganglionic sympathetic fibers? Which neurotransmitter would be secreted by preganglionic parasympathetic fibers? Which neurotransmitter would be secreted by postganglionic sympathetic fibers to the sweat glands? And which neurotransmitters would be secreted by postganglionic parasympathetic fibers? And which neurotransmitters would be secreted by the majority of postganglionic sympathetic fibers? Number 88. Explain and give 2 examples of dual innervations in the autonomic nervous system. Number 89. A patient has a severe case of Raynaud's disease that affects her right foot. What surgical procedure is needed? Postoperatively, would the patient be more likely to be affected from hyperhidrosis or anhidrosis? Okay, so once again, patient has a severe case of Raynaud's disease that affects her right foot. What surgical procedure needs to be performed to correct this? Postoperatively, would the patient be more likely to be affected from hyperhidrosis or anhidrosis? Number 90. If an individual has a history of fainting when room temperatures are high and they have no other symptoms, what is the likely cause of this problem? If an individual has a history of fainting when room temperatures are high and has no other symptoms, what is the likely cause of this problem? Number 91. What effect would external stimulation of the carotid artery have on the heart? Okay. What would external stimulation of the carotid artery have on the heart? Number 92. What precautions should a healthcare provider take into consideration before administering propranolol hydrochloride? What precautions should a healthcare provider take into consideration before administering propranolol hydrochloride? Number 93. Give some examples that suggest the autonomic nervous system may be voluntarily controlled. Okay, give some examples that may suggest the autonomic nervous system may be voluntarily controlled. Number 94. What ways are the autonomic and somatic nervous systems different? Number 95. Why would it take a long time for the heart rate to return back to normal after a false alarm? Okay, number 95. Why would it take a long time for the heart rate to return back to normal after a false alarm? So I don't know. For example, you're driving your car, going down the street, and all of a sudden, police officer uh, turns on his bright lights and his flashing lights and sirens, and he speeds up right behind you, but then he passes you and goes after another car. So when he flicks on his lights and sirens, you look in the rearview mirror, your heart drops down to your stomach, your heart's pounding, you start breathing deeply, but then he passes you up. You're like, oh God, thank God it's not me. He's after somebody else. But if you notice, your heart rate is probably still high several minutes after he's gone. Why is that? Number 96. Why do people often feel sleepy after having large meals? Okay, why do people often feel sleepy after having large meals? Number 97. How can meditation, Tai Chi, or daily prayer help relieve body pains such as migraine headaches or other depression, for example, or again, just stress? Okay. Number 98. What are three possible outcomes that occur when the preganglionic axon reaches a sympathetic trunk ganglion? What are the three possible outcomes that can occur when a preganglionic axon reaches a sympathetic trunk ganglion? So again, in this question, when we're talking about pain, think of pain more related to stress. Number 98. What are three possible outcomes that can occur when a preganglionic axon reaches a sympathetic trunk ganglion? What are the three possible outcomes that can occur when a preganglionic axon reaches a sympathetic trunk ganglion? Number 99. How do the sympathetic and parasympathetic divisions work with one another? Okay. How do the sympathetic and parasympathetic divisions work with one another? And finally, number 100. What are some anatomical differences between the sympathetic and parasympathetic divisions? Okay. What are some anatomical differences between the sympathetic and parasympathetic division? All right, so that's it for Chapter 14's exam review. So again, as I stated, these aren't necessarily the questions that you're going to see on the exam. But again, if you're able to answer these questions, you'll end up doing very well. Again, typically when I gave these exam reviews, the students that studied for this exam review using the material similar to what you're seeing, and who also studied throughout the course, they ended up doing very well on the exams. They ended up getting, most of them got A's and B's. So a lot of A's, a lot of B's. Compared to the people who did not use these study guides or these reviews. So I highly encourage you to take notes. Hopefully you took notes of this as I went through this. And now open up your books and look for these answers. Hopefully this helped you. If you like it, please be sure to give it a thumbs up. If you have questions, please use the comment section below to ask questions. I want you guys to help one another out. So if you post a question, hopefully somebody knows the answer and they'll post an answer. And again, if it's wrong, I'll come up and I'll make a comment on it. Hopefully somebody else can comment on that before I do. But I want you guys to kind of get involved with this yourselves as well. So once again, if you like this video, please be sure to give it a thumbs up. If you haven't subscribed, be sure to subscribe. Also, please be sure to share with your classmates, your friends, anybody you think may find it helpful. Thank you so much for watching, and best of luck on your exams.